Okay. Oh, I guess I can go back to the title. I guess I'll just start. I guess just a quick background of myself. I have been practicing as an occupational therapist for about 8 years now, and a majority of my practice has been in the school setting. So therefore, I focus my program development within the schools, specifically trying to, I guess, include, occupational therapy more into early intervening, like response to intervention with students with autism in that like inclusive classroom setting. So first, just kind of to do a quick overview of the literature review that I conducted. And there's just 3 different areas that I looked into. The first was autism spectrum disorder and the inclusive education. So as we know, IDEA aims to ensure that all students receive their education in the least restrictive environment, which has increased the number of students with autism in like the general education setting. But this, from the literature review shows that it presents many different challenges, though, for students with autism, specifically their sensory processing. From the review, I learned that, inclusive classrooms present an increased amount of sensory stimuli and more unpredictable behaviors, as well as less chance for positive sensory experiences, which can therefore then cause many challenges, behavioral challenges that might not be seen as typical within like that inclusive classroom or general education setting. And then these students, they always feel uncomfortable or, are not comfortable in their setting. They're always on alert for different sensory stimuli. So then it causes them, can be kind of traumatic for them, these settings, causing some toxic stress and, an increase in their behaviors. So the second part was the teacher perspectives on autism and inclusive education. And it kind of came across like 3 themes from the literature review. The first one was that teachers do have difficulty addressing the needs of students with autism. And it's, specifically I found that was their behaviors due to them trying to fill sensory needs. The second was, though, that teachers are motivated to support these students and their sensory needs, but they feel ill-equipped because they don't have the knowledge. Again, specifically, the statements were in like sensory processing. And then the last is that teachers do support the inclusion of students with autism, but they do feel that collaboration with other school-based professionals would be helpful to support them, especially school-based occupational therapists. So that's then when I got into looking into school-based occupational therapy practices and inclusive practices, which isn't, from the research, it shows that it isn't done very much. A lot of school-based OTs are still using that pull-out model. But there is a push to move from that caseload to a workload model where students are supported both directly and indirectly. And that multi-tiered response intervention, it is showing that it is a emerging practice for school-based OTs. However, there are some barriers, which can be the lack of knowledge of what OT's role is in the schools. But colleagues they do desire the assistance from OT when it comes to multi-tiered interventions. So from the literature review, my goal kind of for the program was, I know as a response to intervention, was to kind of start at that tier 1 universal support, like that level. So the program's goal was to kind of focus on developing a program that supports the sensory needs of students with autism, but supporting them indirectly by educating teachers and giving them that knowledge on their sensory needs. I developed the program. The school I work in, it's an elementary school in New Jersey, which supports preschool through 2nd grade students. And then the key stakeholders for this program were administration, and it was specifically the director of special services, the assistant superintendent, and the assistant principal of the school, who is responsible for the school's RTI program. And then the other key stakeholders were the elementary school teachers who support students in inclusive classrooms and who currently work or maybe have worked with students with autism in the past. So following what my plan was for the goal, I conducted the needs assessment, and I used this needs assessment and the literature review to specifically identify the needs that were going to be covered in the program. So I had 4 goals that are listed here. First was to look into the number of students with autism who receive their education in inclusive classroom. And this number, I specifically looked in New Jersey because that's where the school was. And it stated it was in 2018, 9.4% of students with disabilities in New Jersey were identified under the category of autism. And this happened to be around an 84% like increase or change since 2009. So there's been a lot of increase in the diagnosis of autism in those that are supported in the general education setting. In the school that the program was specifically developed for, there were about like 18% that were identified under the category of autism. And a majority of them were spending their time, 80% or more of their day in kind of that general education setting. Then the next 3 goals for this needs assessment, they were researcher developed, or I developed online surveys to send to teachers who work in the inclusive setting and school-based OTs. They're all based kind of in that northern New Jersey area. The knowledge of teachers, a lot of them did state that they have the knowledge, they feel comfortable working with students with autism, but the one thing is they only felt that they had somewhat knowledge in their sensory processing needs. So the next thing then I looked into kind of get an idea of their preferences when they're receiving assistance when working with students with autism and their sensory challenges. I first kind of assessed to see what their knowledge was on OT's role. The teacher and OT respondents had a little bit of a different response. Teachers said that they had a good understanding, but OT, school-based OTs kind of felt that they had somewhat of an understanding of what the role of OT is in a school. So then I looked more into school-based OTs and assessed what their role is in multi-tiered interventions. And again, supporting the literature, a lot of the OT respondents indicated that they mostly use pull-out services, but they do have a desire to become more involved in RTI or, providing multi-tiered interventions. So from this, then I went through and, I'm going to go through the process and the implementation of the actual program. So again, as I, have been mentioning throughout with the literature review and the needs assessment, the needs that I identified for this program were the teacher's knowledge on sensory processing. So to cover this, the goal was to provide them with education on sensory processing and those needs of students with autism. Then the lack of time and collaboration. In order to support this, teachers do desire in-person, but I made it more of a hybrid model for them to receive this information and this education, and also providing them with resource documents that were online. And then trying to figure out how using this can implement school-based OT into response to intervention. So from after identifying the needs, then I, collaborated with administration, and those were the administrators I previously mentioned. I met with them to just kind of describe what the program was or what my goal was, how and when these education sessions would be provided, and to identify participants. Then I, identified the participants, and at a faculty meeting, I gave them an overview of what the program was. Then the participants were sent a pretest, so that, and I'll get more into when I go over the evaluation outcome, but the participants were sent this pretest to kind of get their knowledge and practices, current knowledge and practices when it comes to sensory processing and the needs of students with autism. And in the beginning, I started with 19 participants. There were 2 that dropped out, stating like the lack of time. And then following this collaboration, I began the implementation of the education sessions. So there were actually more that were online. So it was like a 5-week program. So there was 1 education session provided each week. The first 4 weeks were online, kind of provided like on demand. They could listen to them, watch them whenever they needed, or whenever they had time. And then in addition to those, education sessions, I prepared some resource documents to support each of those. Now, all of them were like posted on a resource database, which the platform used was a Google Classroom. So each week, an education session was posted along with resource documents. The last week, so the 5th week, was a in-person training. So again, I prepared that training, presented it to them, and then following that, added some more resource documents. And then just to give an overview of what was covered in those education sessions, there was just an overview of sensory processing. Then I got into the different like sensory systems, or, starting with like the external senses and the impacts it has on students with autism, and then their internal senses and kind of what their needs are in order to support that. And then I also went in and talked about in one of the sessions, positive sensory experiences that they could use to support students. And the last one was kind of a focus on sensory and trauma, kind of, a different way of looking at trauma and how it can be a traumatic experience for students with autism in like a big classroom setting because of all that sensory stimuli that they're experiencing. Then following this implementation, I then went back and had a discussion with the assistant principal and kind of described to them about how this can be implemented into RTI as more of as a tier 1 level support. Because in New Jersey, they're multi-tiered interventions. It does state that tier 1 level supports are provided to a whole group by trained teachers. So I think that the education kind of helped teachers have a better understanding of autism and sensory processing and supporting students with autism, but kind of like a way of training them, and it supported like a whole group. So that was my whole process and implementation. And then I assessed the outcome of the program. So the results, I used a pre-test, post-test kind of method, and gained some quantitative data from that. So it assessed their knowledge before and after, as well as their sensory practices prior to and after the education. The sensory knowledge was assessed like using a Likert scale, which I kind of have what that scoring criteria was. 1, starting with like they had no understanding of sensory processing, to, being very confident in their understanding. And then with the sensory practices, there were multiple choice questions and participants were able to choose multiple answers. So I'm first going to get into the results of the sensory knowledge. And overall, I did see a nice increase, in their knowledge and understanding of sensory processing. There were 5 statements, but I just wanted to highlight the 3 that did seem to have the most impact. So the first were the internal senses. You see here that 2 response was like somewhat, there was like 63% of respondents stated that. And only 10% said that they had, I guess, maybe a somewhat understanding. But then that increased after the training, where there was 41% who said somewhat of understanding, and then it went up to like there's 29% from that 21% that did say they have a good understanding. With sensory processing challenges that impact the responses in the classroom, that also overall I kind of overall 74% total maybe said that they had limited to somewhat response, where that kind of improved following the program, where 82% said they had somewhat to a good understanding. And then sensory overload, this was just trying to get their knowledge on their understanding of when a student with autism is overwhelmed by sensory input, like what they're going through. And about 31% said they had a good understanding, and that improved to like 70% saying they had a good understanding following the training. And then sensory practices in the classroom, and there were like 2 specific areas that showed the increase in using or their potential to use different sensory practices or strategies in the classroom. So with the first one was, again, they had more of an understanding of internal senses, and now they plan to use or are starting to use more strategies in the classroom for students with autism. So with vestibular, it increased from 16 to 53%, saying they were going to use or started to use more strategies. Proprioception went from 22 to 40, and interoception went from 11 to about like 53%. Now, I also kind of assessed their practices, the positive sensory experiences they were using in the classroom. Now, before the program, a majority of teachers indicated that they were using it, or participants said that they were using a lot of positive sensory experiences. But the one I wanted to highlight that showed an increase was the participants indicated again that they were starting to use or plan to use more strategies that help with calming and organizing a student. And that increased from 21 to about 58%. So overall, there was an increase in knowledge and the use of different strategies within the classroom. I also, following that, I just sent out a survey just to kind of see how they felt the education sessions helped them and any continued needs. Again, I got quantitative data from the survey, and 70% did agree that they learned valuable information. 88% feel more comfortable implementing sensory interventions, and 56% indicated that they would like more collaboration with OT related to sensory processing and autism. And some of those were maybe having OT push into the classroom more, maybe provide some, classroom sessions and strategies, like actually implementing them in the classroom. And then I also just had some conversation and extracted some information from that. And so the two themes I came up with is that, again, their knowledge did increase and that they do want some more presentations from OT, stating that kind of the same ones that they get every year at their professional development. They're just looking for something new. So again, I think the program did end up being successful, and helping the participants get a better understanding of the sensory needs and providing sensory strategies in the classroom. And then in summary, there were kind of three things that, I got from myself from this program. Going back to the literature review, research indicates that I'm sorry, I'm skipping one. Research indicates that teachers don't feel, equipped due to their lack of knowledge when it comes to providing sensory strategies and working with students with autism. And I feel like this program supported, and the research does show that when they're provided with education, it does help them with utilizing sensory approaches in the classroom. So I think that this program did support that research, because teachers or participants did indicate that their sensory knowledge increased, as well as their desire to use more of the strategies following the education. Then in addition, research does indicate that when it comes to school-based OT, services are mostly provided by pullout. But there is a push to move from this pullout, this caseload, to a workload to support students both directly and indirectly. And I think that this program does do that. And it actually, I think what it did, it gets some participants understanding OT and wanting further collaboration. So I think, this program definitely, as I mentioned, is a valuable tier 1 support. But from this program, as I know, like the title says, response and intervention, and there's tier 2, tier 3. From this program, it kind of helps to see how more so OT can expand. Like I had mentioned, maybe as tier 1, providing maybe small group instruction or class instruction and pushing into the classroom, and then going to focusing on smaller groups to really help with their sensory needs. And then the last part, I think one of the things I think it really helped was with advocacy for school-based OT. I know myself as an OT, I haven't, had a lot of communication with administration. So I was able to, communicate with them. I think they were, they get a better understanding and were more excited to see how OT can intervene early, prior to referrals. And then I think it also opened up the teacher's knowledge on what else OT can do and help support them so they can support, students with, that inclusive environment, students with autism and even other students who may have sensory challenges. And then just, I guess, to end, there are still, still are some challenges I found, especially with how the research says that most school-based OTs are providing pull-out services. It doesn't leave a lot of room on the schedule. So trying to find time to create this program, was challenging, but I think going forward, if trying to implement these tiered intervention will help kind of maybe change that to that workload model so that services are provided, again, as I mentioned, directly and indirectly to support students. So again, overall, I think the program was successful, but there's definitely some ways that can be expanded on it and moving further to tier 1 and tier 3 approaches. So that was my program. I don't know if anyone has any questions.
Yeah, that was great, Danielle. Thank you. Thank you for sharing all of that. So if Steve or Helen, if you have any questions, by all means, ask away. We've got some time for questions. So Helen's waving her hand. Oh no, she's clapping. I thought you were waving.
I
Nice.
got a quick question.
Yes.
I mean, it was awesome what you did, and I saw so many parallels with what I was trying to do with my program.
Yeah.
Were you surprised? Did you have any surprises when you did the needs assessment that maybe going in you didn't think we're gonna come out of the needs assessment, and then you did it and you were like, wait a minute, I didn't think about that?
I don't know. I think it was just the kind of, I wouldn't say like conflict, but the differences between like the responses from the teachers and the OTs. But some of them in the needs assessment, the teachers were saying, that they were knowledgeable, they were okay with implementing sensory strategies, where I think when there were some OT respondents who said they felt that they were resistant. So that was maybe something I wasn't like expecting, but I think like the program, some of the respondents were different from, who I implemented the program for, but I think I don't think they'll be as resistant after, listening to this, the education that they were provided. Cause I definitely had a lot of teachers come up to me and like thanking me for like the information that I gave them. I don't know, does that answer your question?
Sure, for sure. Thanks.
So I have a question about administration. So how are you going to handle this, presenting this to them moving forward? Like kind of what's your plan?
So I probably gonna put together something like short from what I created, just to kind of show, and it is my plans, just trying to get that time, but just to show them, how it did improve and it did help teachers. And that kind of, and I'm going to give them some ideas of how I would like to kind of expand it. Like I was saying, like tier 2, tier 3, maybe doing some more push-ins. But then also trying to, it's hard because of that caseload model, and they're so used to that. Like just kind of, I think just really, again, continuing to educate, when I meet with them, educate them on all the different ways, that OT can help within the school setting. So I do have a plan I have like information written out that I'm planning to send. So just, finding the time again, but that is my plan going forward.
Yeah, that's great. And just having them understand, like you said, that in the long run, it's going to help decrease the referrals, right? So
Yeah.
at the end of the day, it's going to,
Yeah.
decrease and kind of maybe work out the workload issue
Yeah.
too.
Yeah. And also the director of special services, I'm also actually going to provide a presentation for the paras, because, and I think that'll be really helpful because there's so many of them and they do a lot of support, for the students. So they're always looking for something new and different, because I think they get a lot of the same training every year. So I'm hoping, that will be very helpful as well.
Yeah, no, that's a great idea. That's a great
Yeah.
idea. I think paras, they definitely are always looking to learn more, and
Yeah.
they're like sponges, and it's so awesome to work with
Yeah.
them. There's some great ones out there for sure.
Yeah. Yeah. Mhm.
Good. All right. Anybody else have any more questions? We're good. All right. Well, thank you so much, Danielle. It was awesome. I'm looking forward to kind of seeing where this goes for
Yeah.
you. with
Yeah.
admin and for the rest of the staff. I think it'd be cool. I think it'd be cool.
Yeah, no, me too.
All right.
Yeah.
I'm gonna stop recording this one. Gotta remember myself.